Deep sliding, systematic palpation of the abdomen, the ascending column. Perform hand washing before the contact with your patient. Provide privacy. Prepare all the equipment on the procedure trolley. Greet your patient warmly. Identify your patient. Take an oral informed consent. Explain all the steps of the procedure to your patient. Manipulation can be performed with disposable non-sterile gloves when it can be risk of contact with patient's biological fluid. Ask the patient to undress to the waist. Use supine position of your patient for palpation. The room should be warm, your hands should be warm. Cut your nails before palpation. The couch is prepared. Clean with napkins and place a sheet. Sit on the chair to the right side of the patient for the right-handed doctor. The patient is lying on his back, his head is lying low on the couch, his arms are stretched out, the abdominal muscles should be relaxed and the patient's breathing should be calm, preferably with his mouth. Place the second, the third, fourth and fifth fingers on one line of your right hand together, slightly flexed perpendicularly to the axis of intestine, which runs vertically in the right lumbar region. The palm of the right hand is facing in the direction opposite to the umbilicus. The left hand is placed under the right lumbar region, while the fingers of the right hand press on the anterior wall of the abdominal cavity until you feel your left hand. With a superficial movement, during deep inhalation with the abdomen, the fingers are displaced medially and the skin fold forms the front of the fingers. Straighten the fingers of the right hand until the fingertips touch the posterior abdominal wall. At the moment when the patient exhales deeply, at the end of the exhalation, the fingers slide along intestine. Breathe in, breathe out, and palpation. Breathe in, breathe out, and palpation. In, out, palpation. Identify diameter, consistency, surface, mobility, pain, rumbling phenomena. Ascending colon is palpated in the right lateral flank in a form of mobile, moderate, dense, painless cylinder near 2 cm in diameter. Assist dependent patient in dressing, explain the data obtained during palpation, perform hand hygiene, discard disposable equipment, record the procedure in medical record as required.